Hey guys, so I'm Dr. Zainab Vora, and this interview is perhaps the most special interview which I will have in my life, because this is not just about the rank. The rank is amazing. It is 945 in this NEET exam. I have Dr. Subhashree with me, who has fought leukemia in the last 1 year and fought innumerable complications of drugs, of infections, and has come out an absolute winner. You are the most inspiring person I've ever met. First of all, let me tell you that. Please share your story because it is completely yours to say. So tell us, how was the last 1 year for you?
Um, I I was in my internship in last 2023 when I got to know about my leukemia. Then I got tested and it confirmed my bone marrow that it was leukemia only. Then I went for the Tata Kolkata for my further treatment. There I was started on my regime that asparaginase, vincristine, donorubicin, etc. Then due to asparaginase, as you said by you, it is bone marrow sparing, but it is side effect of pancreatitis, and I got my pancreatitis. It was very severe pancreatitis. Then due to pancreatitis, then I got landed upon septic shock also. Due to septic shock, I was about to go into ventilator also. Then the shock was so severe in the last April. It was on the last April. Then I was there in ICU for 3 days last April. And then after the ICU, my pancreatitis due to I was in NPU for 15 days. Then the follow-up got done, and then that regime was discarded. Then I was much due to aspirational failure. Then I was categorized under high risk VLL. Then there is only one option. I will go on immunotherapy, that is anatuzumab, and then after immunotherapy, I have to go on transplantation. Otherwise, there is very high risk of relapse disease. Then when I was on anatuzumab, there multiple side effects after septic shock on antihistamine. There is drug-induced hepatitis due to antihistamine, and there is many more. Then after that, I undergo transplantation on August 25, 2023. And during that transplantation, after radiotherapy done, my bone marrow is completely evacuated. Then I got into some chemo regime. Then after my transplantation was done, and after 100 days, there is a very severe period as my platelet, WBC, everything was on low side. Then I got 100 follow-up there, and it was very, very high risk period. And during that time, I was very highly anxious about my next report come. And I was thinking beyond my reports only. Then there is a NEET PG, and I said the other way. I couldn't think beyond my reports only. What will be my next report come? Is there any minimal residual disease we say in any cancer? Is there any minimum residual disease in your bone marrow that MRD is called? Then my MRD report came good only. And then after during August, September, October, November, it was very high risk period. And then after I was told by doctors, and I just knew that I am out of risk now. Not out of risk totally. 1 year for 1 year I was on risk, but I was out of risk, and I don't know what to do now. What to do? There is lots more of pain and anxious about what I'll do. Everything is doing there. With job or studying, I don't know what to do or no want to do. Then some of my friends said it is BTS, which is very complex, and you don't want to do anything. You just watch it. Watch only ma'am watch it. Ma'am voice is awesome, and ma'am Subhas, ma'am teaching is awesome. You just watch it. Don't do anything. And during that time, my right hand was also paralyzed due to vincristine side effects with neuropathic side effects. Then I couldn't write or eat anything. I couldn't write or eat in my right hand also. Then I just watch you from November, December, January. I just watch you, and I just practice how to write. I couldn't read anything what I am writing. My hand was just gone. Then gradually, my neuropathy just got down. Then my hand started to work. Then now my hand is fine. Then from November to Jan last, you have the schedule for the March. Then I just watched you. Then from Jan last to then you have given another schedule because due to that our exam got postponed Jan 8, Jan 9. Then
Yes.
from after this exam, I ate. I gave my first city. It is the first city my whole period, whole MBBS curriculum. My
Yes.
internship it was the first. I got 139 correct. I was
Wow.
so I was
Amazing.
so yes, so actually I was knew that I wasn't completely right, but I don't do
Amazing.
anything. I have to just listen to ma'am and do whatever ma'am is telling. Then I just
Wow.
followed you. I just followed you. Then I am here only from
I don't
Jan to
have words, Dr. Subhashree. I really don't have words to say. You are a winner at life. This exam is nothing, this exam is a very small thing, and I'm sure you realize that there are so many students today who have a lot of who take a lot of pressure from this 1 year of the exam, of the result. They have a lot at stake, but what you have shown is this is a very very tiny thing. Life can throw you so many challenges, and all you have to do is fight, not give up, and you are going to come out a winner. And you have you I mean, I can't believe how you have done this. You have taken everything, and the way you said it, that मैम ये हुआ था, this was life changing, फिर मैंने ये कर दिया, I was doing this was very very life changing, and I just did this. You have sailed through all of the things that life has thrown at you, and you have come out so strong. And I think this is just universe. Your rank was destined. I mean, I don't think this is something which is an achievement. Rank 945, it is a gift which had to be given to you for what you have suffered, and for what you have gone through and shown up and survived. So kudos, and I'm so proud of you that you have had the courage to study when your right hand was not working. You had the courage to still make notes even though you couldn't read, but you wanted. You had that fire burning inside you that I'm going to do this. So you are remarkable. Uh, how do you feel today, having been through so much and being on the other side? And I pray, and I think every viewer is going to pray that you stay in remission and everything stays okay. uh, how are you feeling today?
I'm, I couldn't express how can I feel. I was always watching you to teach us in the unique way, and I am talking to you nothing more than I could expect from this. And that is I even in 2022 I couldn't think in 2023 I just get leukemia. In 2023 in August 26 now, in this time previous year I was in isolation room going under my transplantation. In this 2024 I am here. Life is so unpredictable.
Yeah.
I
Yeah.
couldn't think of it.
Yeah.
And I
So
remember you
yeah.
I remember you gave us a PDF of oncology whose son was on. I read that, and I couldn't think anything because no one could relate. There's more than it's more than me only,
Yeah.
and our life is that only. It's
I think,
exam is a part of it.
your story shows that don't take life for granted. Even though we are preparing for this exam, it's a very small part of our life. Don't let your happiness and your success be dependent on that. There are so many things, and how you have said, in 1 year, from 1 year to the next, your life has gone full 360-degree, and you have to be ready to face whatever life throws at you, and do it with a smile on your face, like how you are smiling today, having won through so many challenges. Very very wonderful. If we can talk a little bit about some advice to your juniors, who have a lot of mental health issues. Some of them also have health issues. How was your mindset like that time? What were you telling yourself? And I'm sure you would have a strong support system, so if you want to talk about that.
My friends and my family was constantly there. They are because of them I'm here only. They are
Absolutely.
constantly supported. Then what was every day told us ki baby steps. Think
Yeah.
about today, don't think about tomorrow and day after tomorrow. Never think about tomorrow and day after tomorrow. Think about today and today's time. When I was studying in so much uncertainty, I don't know what will happen next. I just think of today. I have nothing to do today though. Just watch ma'am's thoughtful lecture, ma'am's radio lecture. So what can I do now? It happened to happen. So nothing can be done, nothing can be unchanged. It a life is this only. So I just have to think about present thing today, this moment only. How I will spend this moment such a way that in tomorrow I will never think about the yesterday that I just wasted this much time. I could have done this, I could have done that, but I didn't do. I just was thinking about my what I'm going through. But this only kept me motivated. That I such a way I have to spend my time that tomorrow I don't think about my yesterday. This
Amazing.
only.
One day at a time. Yeah. So that's the message to everybody, and there can't be a more beautiful message. And thank you. Yes.
I can add to this that ma'am. So people are just thinking about the exam was postponed, the result is that. I just want thing to tell them that. So there is you have also said this that there is more bad things happen in life. No, more bad things. If you are getting that news that yes, exam got postponed, yes, your exam got cancelled, that this is so much. We pray to God that this must the bad thing we must get, not beyond this. This is the bad and the worst thing we must get. This is not the beyond thing. This is my final message to those got exam cancelled and this thing.
Yeah, these issues seem very small in the grand scheme of things. To everybody going through them at the time, it seems like the biggest challenge. But you have seriously opened up everybody's perspective, I believe, through this video, that there are so many worse things which can happen. So don't fret over the tiny things in life. It will all be okay. You just have to tell yourself, whatever life throws at me, I'm gonna deal with it one day at a time, and that is what you have to say. I am so happy that I got to talk to you. You have actually enhanced my life. I don't know, you were thanking me for doing that, but that's not the case. I have to thank you for giving me a perspective, because I before I came to this interview, I was very very stressed. मुझे ये भी करना है, Zara is not eating, ये वो. Now all of that has disappeared from my head. I feel so petty in front of you. So thank you so much for being an inspiration to all medical students, and to all of us. I think we look up to you, and I will strongly advise everybody to save this video and keep it with yourself to remind you, what is the power of self belief, that you are a true example of. So very well done. Please congratulate and convey my regards to your family. I think they deserve this, more than anyone. It is their victory and your victory completely. So all the very best, and we pray for your health, that you stay in remission and you become the best doctor out there. And I don't think anybody would have as much compassion for the patients as you would. So many congratulations and all the very best. Do you have any final words to say?
My final word should be don't let your life to lead you. You lead the life. When you let the life to lead you, then it will be only be mess. Then you
Yeah.
lead your life. My final message. And believe on Janim. Nothing
Thank
more than that.
you. Thank you so
Yeah.
much. That means the world to me, and God bless you always.